Well, welcome. My name is Chris Campbell, owner and physical therapist at Sport and Spine Physical Therapy in Portsmouth, New Hampshire. My latest project has been around to seek out experts in the New Hampshire Seacoast area on various topics that my staff and I get lots of questions about. One of those topics is around the idea of PRP injections. And today we have the pleasure of having Dr. Andy McMahon from Atlantic Orthopedic and Sports Medicine in Portsmouth, New Hampshire. Welcome, Andy.
Morning, Chris. Thanks for having me.
Oh, thanks for being here. It's quite a pleasure to have somebody like yourself here.
Oh,
So I understand that you're quite a local here with your undergrad and graduate degrees. So where did you go to school, Dr. McMahon?
So I went to my undergrad at the University of New Hampshire, and I was a little confused when I was a young man. I thought I wanted to be an engineer, and I never really paid attention to the fact that I didn't do my engineering homework, and I'd be looking at the anatomy books at the library. So I graduated with a degree in engineering. I lasted about 2 weeks in engineering and pulled the ripcord and looked for a new direction. And I found medicine actually through ski patrolling. I kind of bailed out of New Hampshire, went to Colorado, and through that, I met a bunch of docs and nurses and paramedics, and that kind of pushed me down the pathway towards medical school. And my medical schooling I did at the University of New England. And then I did a residency training in internal medicine at Maine Medical Center, worked for a few years, and then went back and did fellowship in sports medicine and ultrasound for a few years also at Maine Med.
Fantastic. Yeah, quite a New Englander, and quite a neat story, and how you came around to come to your passion and you know, what you do every day. That's great. So around the topic of PRPs, you know, I understand one of your passions for going to work every day is to diagnose and educate people. I know that's something that's you know, you've shared with me in the past that's important to you. And so what we'd like to do today is you know, allow you to do what you love to do and educate people.
Absolutely.
So PRPs falls under the regenerative medicine topic. So what is regenerative medicine?
Regenerative medicine is kind of a newer field, and essentially what we're trying to do is to treat things that we typically didn't have good treatments for. So a lot of the things that we see in sports medicine and orthopedics are injuries that are kind of wear and tear and chronic, and they don't respond well to you know, typical treatments like cortisone, and they don't always respond to therapy or to surgery. So what we've done is we've started using your body's own immune system to help treat things that are otherwise kind of stagnant and not healing.
Okay. And one of those things happens to be PRP. So
Yep.
what is PRP? That's an acronym, I believe. That's the letters. What does that stand for?
So PRP stands for platelet-rich plasma. So plasma is the liquid part of your blood, basically. You also have in there, you have red blood cells and white blood cells and platelets, but plasma is the liquid part of it. And it hosts a lot of the immune chemicals that you have in your system that your body uses to heal and to fix injury and illness. And so what you do is you use that fluid to treat some of these injuries and deliver a much higher concentration of these healing factors to things that are otherwise kind of deteriorated and unhappy.
There's other ways too, right? There's another type of injection that you use as well.
Yeah, so for the last year or so, I've been using amniotic fluid, which sounds a little bizarre, and people kind of look at you funny the first time you bring it up. But so it's a tissue derived from placenta, and if you think about what a baby is inside a mother, it's basically a foreign invader. And so the placenta tissue is very unique in the way it can modulate the immune system and also provide healing, and it's full of growth factors and all kinds of things that can help heal things. And so using this fluid, I've been having some really pretty interesting results in terms of treating the same types of things that I've historically treated with PRP.
So how are these injections done then? So I believe, I understand, since both are coming from two different types of tissues, I assume that the way you get the material to be able to inject is different. Can you explain that process?
Sure. So PRP is actually the patient's own blood product. So if you were coming to see me for a PRP injection, you would come in early. We take about 30 mLs of blood, and it gets put into a special machine that spins down the blood, separates out all the various parts, and you're able to take off the piece that we use for the injection, which is the plasma and the platelets. And then we use that for the injection. When we do the amniotic fluid injections, those are actually derived from C-section, baby deliveries in the hospital, and they're taken to a laboratory, they're purified, and they're actually dehydrated. So when people come in for that injection with me, we have purchased the product ahead, and my assistant and I reconstitute it with saline before we inject it.
So I know a common question when you're doing this procedure, as you stated, you're using a needle. So I would assume that people would want to know, does this type of procedure hurt?
So I use ultrasound for all my injections. So a lot of pain can be limited by knowing what you're working towards and using a lot of numbing medicine when you prepare the patient to do the procedure. I would say most of the procedures I do, they're not, it's not like getting a massage is what I tell people, but you certainly see it is nowhere near as bad as most people imagine it is going to be. I think with the PRP, often the most painful part for people is the blood draw. If you ever had your blood drawn, they put that big needle in you and they suck out blood. And I think that's often worse than what I do to people. And the amniotic fluid injections I find to be pretty painless for most things. There's some pressure with the fluid going in, but it's usually heavily premeditated. We put it right to the right spot, and there's no guessing or fishing around. So I don't think most people do too bad with the procedure. They typically leave feeling numb because I use a lot of numbing medicine. But what I do warn people is when the numbing wears off, these injections their goal is to rev up the immune system and to create healing. So much like a fresh injury would swell and be painful, you're going to get that same response with these injections. So usually for a few days after the injection, people are sore. And I think that's the worst part, not so much what we do with the needle or do to them here in the office.
Wow, that's good to know. So far, a lot of positive things. You're using some of the body's natural ways to heal, spar up a inflammatory response. The needle isn't so sore. It's more just very similarly when the person first got injured, probably a year or two ago, in a chronic nature. So far it seems real positive. Does insurance cover this type of a procedure?
No, and that's the tough part. There are, the only insurance I have ever had are found willing to pay for this sort of stuff. Sometimes workers' comp. So if you were hurt at work and we're treating you for an injury, they often have recognized the value in this stuff as a way to avoid having to pay for the surgery ultimately. And then active duty military people, we've been able to get approved, but I've yet to find any Medicare patient or commercial insurance patient that will get this paid for. And that's often a tough selling point, even though I've had such positive results.
Sure. So again, there's a lot of things that are worth spending money on. And so how many treatments might somebody need to get the best results that you've seen from either PRPs or amniotic injections?
So it's different for everybody and different for each problem that I treat. I typically shoot for this to be a single time treatment. And that's what I hope. And that's what I kind of prepare the patient for. If we do it and we have great success, then great. Some people will come back and, there are some things that we treat where the damage is extensive. We see that in the Achilles sometimes, or in plantar fascia, where they come back and they feel 60% better, in which case I may try to talk them into trying another round and maybe putting a little different focus on the area we treat. And then there are some people that come back and don't get the benefit that we're looking for. And if it's been a total flop, I might look to try a different approach or a different treatment rather than say, let's keep doing this. And even though it's been futile to this point.
Great. No, it sounds reasonable. What percentage of your patients, feel better after these types of injections? What kind of results are you seeing?
Yeah. So I've been using PRP for a long time, and depending on the issue you're treating, if you took all comers that we treat with PRP, I usually tell people it's around 65 or 75% of people that are going to see a benefit that makes them satisfied. So that's pretty good, especially when you consider that your alternative is deal with it or go have surgery. But there is that percentage that, comes in and does that sort of thing and doesn't get the result. I've only been using the amniotic fluid now for about a year. And when I first started, I had about 30 or 40 people, all with completely positive results. And it seemed almost too good to be true. And I think it is. I am starting to see some people that aren't seeing that complete success. But it's been very promising, and I've really been really interested in treating people with that more so these days than the PRP.
So what kind of decision criteria do you look at when they come back for the second visit in order to make a decision whether a second or a third injection might be necessary?
I guess the best answer again is it's kind of individual, and how interested the patient is in going down that road again and spending money to do this stuff. You know, if they told me it was 10% helpful, I probably would push them less so than if they said I'm 60% better and things feel positive. I'm probably going to try to get that person to say, let's give it one more try and see what we can do to make this better for you.
Are there any things that the patients themselves can do to support this process?
Yeah, so one of the big things that I try to instill in patients when we're talking about doing this sort of thing is that we want to eliminate medications that could interfere with what we're trying to achieve with these injections. You know, so these things are in a way they're pro-inflammatory. So we're trying to rev up the immune system and get things to heal. So I typically ask people to stop using anti-inflammatory drugs about a week before the procedure, and then for at least 2 weeks after. And by anti-inflammatories, I mean things like ibuprofen and Aleve and Motrin, and you know, some people are on prednisone and that sort of stuff. But that seems to be helpful. I don't know how good that science is, but it is something that we all kind of universally ask people to do to give this the best chance to work. And then afterwards, I generally try to restrict activity to a degree, depending on the body part. Sometimes with lower extremity injuries, I'll put them in a walking boot. It's obviously a little bit harder with a shoulder or an elbow or an upper extremity thing to immobilize, but I will generally have people stay out of the gym and you know, trying to go easy on whatever part we treated for a bit.
So it's a lot like when someone first gets hurt, and when the body starts to produce these inflammatory enzymes, if you will, you're trying to encourage the body to do that with some of the natural you know, additives that you're injecting, utilizing a lot of cases the person's own fluids, but then taking it a step further and not suppressing inflammatory reactions that the body is, and then adding even more protection for that region. Is that correct?
Yeah, I couldn't say it better myself. You know, we're essentially trying to almost recreate the initial injury to kind of trick the body into trying to heal it the right way, you know, on the second go around.
So you spoke earlier that you've been doing amniotic injections for about a year. You've been doing PRPs longer than that. And you also said that there's many insurances that don't cover it, unfortunately. So does that mean that this is experimental? Is there science behind this?
There's a lot of science behind both of these. But you know, really what both of these things lack at this point is an FDA approval for the application of using these in the office. So the surgeons have been using PRP, and they've been using some amniotic fluid stuff. They've been using collagen patches and things like this in the OR. And that gets kind of bundled into the surgery cost, but because it's not FDA approved for how we use it here in the office, it has not been, you know, that's why it's deemed experimental. There are, you know, millions of people that have these injections and have these treatments, and they are safe and have, you know, data behind all that. It's more of the game that we play with insurance and certain approvals through government agencies that have kind of held these back. You know, so they have a good safety record, I guess is what I'm trying to say, but they're just not at a point where you're going to see commercial insurance paying for them because the government is holding us back a little bit.
So once they have the injections, they get the results. How long can they expect to see the results last? Is this a temporary thing? Is this something that should last indefinitely?
So that's a good question, and people's results are going to be individual, you know, and I kind of paint it that way when I kind of consult with people beforehand, you know, you know, these are things that take a while to work, if they're going to work. Usually, you know, at 3 or 4 weeks, you start to see some good benefit, and at 3 or 4 months, you're still in the healing process. And how long they last, again, is going to be individual. I've had people that have had these injections and they are still doing great years later. There are some conditions that we treat, like, for example, knee arthritis. I don't think that fixes arthritis, but it does modulate the pain and the inflammation and improves function. But people are generally going to need to come back and maybe consider that treatment again, you know, a year down the road. So it really depends on what you're treating, but I've had some really positive results with partially torn tendons and ligaments and the plantar fascia that have really healed and gone on to do very well.
So these great non-surgical approaches to really speeding up healing and getting people back to what they love to do with much less pain.
True. Yeah. I mean, that's what I talk to people about. You know, the conversation always kind of goes to the financial commitment to, you know, throwing some money out there, and I can't promise them that it works. But then, you know, when you step back and consider the cost and the disability and the time down and all the stress that goes with having surgery, I think when you step back, there's some substantial benefit to trying this sort of stuff first.
Sure. What do these injections cost?
So the PRP stuff, the injections for that, basically, I think our office charges around $600 for it. And what you're paying for is the blood draw kit and the centrifuge kit to extract that stuff from your blood. And that's what the insurance won't pay for. The amniotic fluid injections they are dose dependent. So a small structure, like a tennis elbow, might be $500. Most things I treat fall into the $800 range, like a rotator cuff or an Achilles or a plantar fascia. And there are some that are for bigger joints that are over $1,000. So it's a decision that you have to you can't take lightly, because it's, for a lot of people, it's a fair amount of money.
My understanding is that these are primary treatments for tendons and ligaments, correct?
Correct.
Okay. And how about joint space? Is this a treatment for inflammatory reactions in joint spaces as well?
It is, yeah. So with both the amniotic fluid and PRP, there's literature for both that they can be beneficial. I have done a fair amount of PRP into some joints with decent results. Same with the amniotic fluid. At the risk of disclosing something about myself, I have bad arthritis in my right knee and had a ski injury where I ripped up some of the cartilage last spring, and I was draining fluid out of my knee, and I had a large Baker's cyst that I was draining fluid out of on a weekly basis. I tried cortisone, it didn't work, and I actually went on to try the amniotic fluid injection, and I still feel like I'm getting really good benefit from it. You know, I don't think it has fixed the cartilage injury that I have. I don't think it's fixed the arthritis, but it's certainly shut down a very angry immune system, and I'm back to skiing and biking the way I like to.
Wow, that's a great story. That says a lot about that you tried lots of what we've known as traditional pathways towards these type injuries, and now getting into more of the regenerative medicine and finding some fantastic results.
Yeah, and to be honest, I'm a skeptic of all this stuff, you know, because we haven't proven it's truly the best stuff out there. But I've been very impressed with my result, and I still feel it's really helping.
So if somebody was interested in at least having a consultation with you to discuss this, how would they go about doing that?
So if this is if this is a patient that's working with a physical therapist, often they can help put you in touch with me. We have a website, AtlanticOrthopedics.org, that they can look to. They can also just give a call to the office, and our number is 603-431-1121.
Well, it's been a great pleasure to have you, Dr. McMahon, and discussing the topic of regenerative medicine, particularly with PRPs and amniotic and fluid injections. I think we're very fortunate in this day and age to have many options of treating our aches and pains, getting us back on the slopes, getting us back on the field, getting us back to work, getting us back in the garden. And we really appreciate your time for and your knowledge sharing with us. And we hope you have a great rest of your day.
Thanks for having me, Chris.